All right, so I've had a patient come in with a painful lesion on the end of their second toe. So you can see basically right in through here, there's a thickening in the callus section. There's a bit of a breakdown in the center. So this is pretty typical of an apex corn or a callus, and they become very painful. So they develop in this region because of like all corns and callus, they develop because there's more pressure in that area. So it's usually when you're clawing the ground, gripping the ground, or your shoes are too short, bumping into the end of the shoe, or anything that can cause pressure on that tip. So we go ahead and remove this. Now this has got general diffuse callus is what we'd call that. And then you can see just down to the bottom where it actually pinches on the side, you can see that darkened section is more like a corn, but it's this really long moon-shaped section. So we use the number 10 blade here because it's the right shape to actually get straight in there and actually get it all out in one go. So this is more almost like removing the corn section here, but it's just in that moon-shaped section. So we go ahead and remove all that. That'll be what's causing the actual pain or the burning, shearing type pain this patient's getting. So we go ahead, remove all of that, not being, of course, always careful not to take too much of the callus there, and then just looking to see if we've missed any sections, because if we've missed any little bits, they can actually be more painful now that we've removed that overlying callus. So we want to make sure we get all of that out and then sand that smooth and try and get the patient to check their shoe length, see if they're clawing their toes when they walk, and then use some moisturizer to try and soften that skin as it grows back. And you can use things like a pumice stone or a file to try and keep that under control, but generally we usually try and do this maybe once every 8 to 12 weeks. And if it's really growing back quickly, maybe 6 weeks. You'd have a look at that depending on, really it's up to the patient's preference. Once there's no risk of infection, it's up to their preference. But you can see that moon-shaped corns come out of there. It's a really long, really thin, really diffuse callus with that corn around the side. So that's what would have been causing the pain, and that's how we remove one of these from the tip of a toe in the podiatry clinic.